Hello, welcome to sonography-radiology training channel. This series of videos is about normal skull X-ray findings. This is the first video in this video series with title of Normal Skull X-ray Findings, Simulate Disease, Part 1. In this brief video, we will review a few cases of normal skull X-ray findings together. Case 1. These images are related to a neonate. What do you think? Are there any skull fractures here? At first, seems we have encountered with the skull fractures and we have to check about child abuse. But these images are overlapping sutures in a neonate secondary to molding of labor. To accommodate passage through the birth canal, the fetal skull is compressed and reshaped, a phenomenon known as molding. The fetal skull bones are separated by membranous sutures that facilitate compression and overlap, resulting in a reduced diameter. This increases the possibility of a successful vaginal delivery. Case 2. As you can see, we have an unusual appearance in the parietal region with reticular pattern. But this appearance is related to scalp folds in a neonate, producing in an unusual appearance in the parietal region. Another example of scalp fold, a scalp fold in the occipital region that could be mistaken for a fracture. Case 3. In this image, we can see a lytic skull lesion with thick sclerotic margin in parietal bone, highly suggestive of a neoplasm or metastasis. But really, it's hair braids producing an unusual shadow at the vertex of the skull. Another image, we can see here two partially well-defined sclerotic lesions. But another one, they are hair braids with surrounding elastic bands which simulating sclerotic lesions. In this image, we can see multiple sclerotic bands in frontal and parietal bones. But another one, there are multiple small hair braids famous as cornrows producing unusual shadows in the frontal and parietal areas. Case 4. These images show two examples of prominent but normal diploid patterns of the calvaria, which are diffuse throughout the skull, but sometimes this pattern may be localized, as you can see in this image. In this situation, it can cause mistake. We have localized prominent diploid pattern in the parietal bone, which produces a streaking appearance in Waters projection. Case 5, we have two images here. It's related to a neonate, this one in 19-year-old man. As you can see, we have localized irregularities and striations in the vertex of the parietal bone caused by the serrations of the sagittal suture. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.